Good morning, everyone, or good afternoon, depending on where you're located. My name is Arthur Allen. I'll be moderating today's webinar on Advancing Anticoagulation Stewardship, a Playbook. Webinar is about the rollout of the very exciting Anticoag Stewardship Playbook, recently published. And today we have with us some guest speakers. We have, of course, myself, Arthur Allen, the moderator. We have Allison Burnett, who is the lead pharmacist inpatient antithrombosis stewardship at University of New Mexico and the current president of the AC Forum. We have with us Scott Kaatz, a hospitalist from Henry Ford Hospital and a former president of the AC Forum. And then we have special guest Chelsea Lynch, the director of the Emerging Initiatives at the National Quality Forum, and Scott Winiecki, director of Safe Use Initiative, U.S. Food and Drug Administration, the FDA. These are the disclosures for today's lecture. And as a reminder, this is accredited for continuing education credit. The instructions are here and will be posted as well in the chat, so you can claim credit for this educational session. At this time, I'm going to turn this over to Dr. Scott Winiecki to go through his slides, and we will learn a great deal. So I'll stop my camera and off we go.
I just want to thank the AC Forum and NQF for having me today. My name is Scott Winiecki. As Arthur mentioned, I'm from the FDA Center for Drug Evaluation and Research. And if anybody wants to contact me and reach out and ask questions about my presentation or what I do, my email is at the bottom, Center for Drug Evaluation and Research, CDER, Safe Use Initiative, at fda.hhs.healthandhumanservices.gov. Next slide, please. So really have two messages in my brief talk today. One is what I do at FDA, and that is I direct the Safe Use Initiative. Our goal is to reduce preventable harm from drugs by identifying medication risks and partnering with groups who are committed to safe medication use. Primarily, we fund this primarily we accomplish this by funding outside researchers, which are external to FDA. So we funded this project with AC Forum to develop the playbook. Next slide. So why anticoagulants? This is my second message. Anticoagulants are associated with more adverse drug events than any other drug class. These are often serious, right? We're all familiar with these: bleeding, thrombosis, and death. So these are not trivial events, but have serious clinical impact. And inappropriate prescribing and dosing errors are frequent. It continues to be a problem to identify the right patients to be on anticoagulants and to get them on the appropriate dose for their indication. Next slide. So the bottom line message here is that anticoagulants are a common source of both serious and sometimes preventable harm. I don't think we're ever going to use these medicines so that there are no adverse events. I just don't think that's humanly possible, but I think we can reduce a lot of adverse events if we make sure we get the right patients on them, we don't start patients on them that shouldn't be on them, and we get them on the appropriate dose. And I think a lot of anticoagulation stewardship, this is now the second project my group has funded with Anticoagulation Forum, a lot of that stewardship is about accomplishing that goal, using these medicines in the right patients at the right dose. As the group that funded this, I'm very excited to see the playbook be completed and looking forward to today's webinar. And I just want to thank Anticoagulation Forum for doing this work and for inviting me to speak. Thank you.
All right. Can everybody see my slides?
You're in presenter mode. I mean,
swap displays.
Yes, perfect.
Gotcha.
There you go.
All right. Well, hello, everyone. Thanks for joining today's webinar. And thank you, Scott, for framing up this critical issue so nicely and for all the important work you and your team are doing through the Safe Use Initiative. The Anticoagulation Forum is absolutely thrilled with the partnerships we've been able to develop with the FDA, with the National Quality Forum and other federal entities to raise awareness around this. And so thank you for taking time to join us today to to raise awareness among the attendees, and also to highlight the valuable resources and tools that we've developed through our partnerships. And then very importantly, to help us kind of convey this vision that we have for the future of anticoagulation stewardship. So as you mentioned, Scott, anticoagulants are the leading cause of outpatient emergency department adverse drug events, now accounting for more than 20% of these outpatient events. And I think concerningly, this isn't just isolated to the outpatient setting. This is a pattern we're seeing across acute care hospitals. We're also seeing it in post-acute care facilities. You also highlighted a really important recent systematic review and meta-analysis by Al Rowley, highlighting the trouble with DOACs, right? About a third of these patients are experiencing some type of medication error, which is concerning because these drugs now dominate prescribing patterns. And in that same analysis, I believe it was shown that about half of the DOAC associated medication errors are happening at the point of prescribing. So as you mentioned, I think it underscores the importance of having anticoagulation stewardship embedded from the outset and at every point through the continuum of care to try to mitigate patient harm. And DOACs are only part of our problem here. We have a half a dozen other high-risk anticoagulants and their associated therapies that make management of this population extremely complex, and it's only going to get more so as we move forward. So I think that's just, a compelling reason to think about, this important call to action for anticoagulation stewardship. So anticoagulation stewardship goes well beyond anything we've conventionally done in regards to anticoagulation management, which was often siloed in various care settings like clinics or inpatient, and really focused on drug management. Conversely, when we're talking about anticoagulation stewardship, we're talking about a much more holistic, multidisciplinary approach that spans the continuum of care and more so focuses on disease state management. And in addition to all of those clinical aspects, it incorporates continuous quality improvement so that we're always looking for barriers or deficits and building opportunities to improve care delivery and improve patient outcomes. So when the Anticoagulation Forum as an organization adopted stewardship as a key strategic initiative, we recognized that there was a highly successful and readily available blueprint available from the antibiotic stewardship realm. And we have very intently followed that successful model through our evolutionary journey and targeted similar milestones that you can see highlighted in the slide here, with antimicrobials at the bottom and anticoagulants at the top. And so our first key milestone, Scott, was actually with you through the Safe Use Initiative and the FDA in developing core elements for anticoagulation stewardship back in 2019. And in doing that, we were mirroring what was done with antibiotic stewardship through the CDC back in 2014. And, that partnership with you and the FDA set us on a really good trajectory. And since that time, we've been able to achieve other key milestones, including the development of specialty training programs highlighted in the yellow boxes, as well as implementation guidance in the green boxes, which is the focus of this webinar today. And so we're on a really good trajectory. I want to mention that our ultimate goal is highlighted in red, and that is bringing to fruition national level requirements, standards, mandates, whatever we want to call them, that make anticoagulation stewardship a requirement in all care settings, similar to the condition of participation that exists for antibiotic stewardship programs that is mandated by CMS and became a requirement back in 2019. So I'm listing the core elements of anticoagulation stewardship here. I'm not going to read through these. Scott and Chelsea are going to touch on these in the playbook. I did want to mention, though, that securing administrative leadership commitment is the most foundational and fundamental of these, because if you don't have this, you're not likely to be successful or sustainable. And we fully recognize at the Anticoagulation Forum that often the most daunting and challenging step in getting started in all of this is having that conversation with your C-suite, with your administrators, et cetera. And so in recognizing that, we've developed some tools to help foster those dialogues. And so on the left here is the Core Elements Guide for Anticoagulation Stewardship Programs. And we developed a companion document to this, which is a baseline checklist that clinicians and hospital administrators can complete together to do a landscape survey of their current status at their institution, identifying deficits and opportunities for anticoagulation stewardship. So in addition to that checklist, Darren Triller, our Director of Strategic Initiatives at the AC Forum, in partnership with an amazing pharmacy intern, Lauren Inglis, developed these very helpful advocacy documents you see highlighted in the screenshots to the right. These are very distilled, highly efficient, highly effective one-page documents that you can use as talking points to start a dialogue with your administrators and your colleagues. And we have a couple of different types here. The one in the foreground is a summative document of the national level efforts and momentum around anticoagulation safety and quality. The other two documents highlight published successful anticoagulation stewardship initiatives that serve as really effective demonstrations of feasibility of implementation, as well as a positive impact on patient care. So all of these resources are available for free to anyone who's interested, and you can download them from our Anticoagulation Forum website at the address you see at the bottom of the screen there. The last milestone in our journey that I want to mention before I turn it over to Chelsea to talk about the playbook is a recently approved PGY2 specialty pharmacy residency in thrombosis and hemostasis. And we were able to partner with the American Society of Health Systems Pharmacists, ASHP, and we were able to get this done and across the finish line and approved due to a group of amazing anticoagulation pharmacists from across the country that we convened, including the outstanding team led by John Fanicos at Brigham and Women's Hospital, who are in fact actually, they launched the very first PGY2 specialty residency in this area in July of this year. So in the same vein that PGY2 infectious disease pharmacy residents were a major catalyst for wider spread implementation and adoption of antibiotic stewardship, we feel that there's a similar opportunity to do that with a PGY2 in thrombosis and hemostasis for broader implementation of anticoagulation stewardship. And the Anticoagulation Forum is very excited and honored to be able to offer grant funding through our TRAIN program for an additional 4 sites that you see listed here for the next academic cycle. There will be an additional round of funding next year. So if you're interested in this, please be sure to check out our website. And I'll just mention this is a shameless plug. All 5 of these programs, these 4 and including Brigham and Women's, we're all recruiting for candidates. So if you have any really strong PGY1s that you think might be interested, please send them our way. I'm going to pause there and turn it over to Chelsea to tell us more about the implementation playbook that we developed in partnership with National Quality Forum. This has already been hugely successful with more than, I think, 500 unique downloads and more than almost 2,000 visits to the site. So we're very excited about this. We think it's going to provide a lot of visibility and momentum. So Chelsea, please take it away.
Great. Thank you so much, Allison. So yes, my name is Chelsea Lynch, and I'm a Director in Emerging Initiatives at the National Quality Forum. I'll share just a little bit about NQF and how the Anticoagulation Stewardship Playbook was developed. So for those who may not be familiar, the National Quality Forum is a nonprofit, nonpartisan, membership-based organization established in 1999 with the intent of being a consensus-based entity, or CBE for short. As a CBE, NQF brings together public and private sector stakeholders to reach consensus on healthcare performance measurement in critical areas in need of improvement in order to make the US healthcare system better, safer, and more affordable. Our mission is to be the trusted voice driving measurable health improvements, and our vision is that every person experiences high-value care and optimal health outcomes. Now, while many of you may be familiar with our endorsement work, NQF has been furthering its mission and vision through our emerging initiatives work, which includes implementation guides and playbooks. As we know, the healthcare landscape is ever-changing, and there are critical gap areas that are impacting patient safety and patient outcomes. In order to support healthcare systems to bridge the gap between existing practices and quality care, we've created various implementation guides and playbooks. These are practical, action-oriented guides detailing best practices and lessons learned, implementation strategies, barriers and solutions, and key resources to drive change in specific topic areas. To date, we have 10 guides covering topics such as antibiotic stewardship, opioid stewardship, shared decision-making, and food insecurity. Our latest work, and why we're here today, is the Advancing Anticoagulation Stewardship, a playbook, which we've created in partnership with the Anticoagulation Forum through funding provided by the FDA. The playbook was created through a multi-step, 10-month-long process. First, our team conducted an environmental scan to assess evidence-based practices, existing resources, and guidance. Then, as a consensus-based entity, it was important that we obtained a variety of perspectives from stakeholders across the field. To do this, we conducted various key informant interviews, as well as all-day virtual forum with over 25 experts. These experts included patients, doctors, nurses, C-suite executive, stewardship program leaders, data experts, and various federal agencies. These approaches allowed us to hear about innovative practices that were happening but perhaps not published, and get real-life feedback from those in the field. As a result, we were able to identify overarching strategies that were tailored to those just starting in their stewardship program journey, and for those who already had programs in place but were looking to continuously improve. Through these approaches, we were also able to identify the most common barriers to implementing each of ACF's anticoagulation stewardship core elements and provide corresponding solutions to overcome them. Once we gathered the content, we spent a few months synthesizing the information and producing the playbook itself. To ensure we captured the best information, we had the report go through a review process, which included peer review from top experts in the field, as well as a review from ACF staff, board members, and committee members. Finally, it's not enough to just have the information, but to ensure that it's presented in an easily digestible manner that anyone can pick up and quickly get started with. Our team spent careful time crafting the visual component of the guide to ensure it embodied the content within. And I'm going to turn it over to Scott to provide a few more details about the actual content of the playbook itself.
Thanks so much, Chelsea. And if we could bring those slides up, thanks. Let me just start off and reiterate some of what Allison said, so we all appreciate this journey. About 7 years ago, the AC Forum board got together, and we said we had been a traditional educational organization, but we really wanted to move the needle. We wanted to change the national landscape. We really wanted to bring this front and center. We were starting to see the clues of the problems with the DOACs. And although that literature wasn't very mature at that time. So our first partnership with the FDA and our award was going and setting the core elements that Allison showed you. That was sort of what you should do, define the issues. Now the playbook is how do you fix that? What can you do to work on those core elements to get you a true stewardship model or improve the care of the patients? And when we have looking to the future, we're hoping to continue to work with the FDA and then start to actually show how some tools can actually work. And hopefully that work will continue. So it's really been a methodical process over the last 7 years. And really, I think all of us that are members of AC Forum should be really proud and excited of how far we've come this far. The other thing is that really also neat is that we are now going to fund these new residencies. So we'll actually be training folks on how to do this within their hospital. So this has been really quite a methodical approach to this, and one that we are quite confident is going to make a difference. Can I have the next slide, please? The playbook is brilliantly put together. And National Quality Forum is really, in our opinion, the go-to folks for this, which is why we're excited to work with them. And Chelsea has been really quite modest on how well respected this organization is, particularly in the quality circles and in places like Joint Commission and CMS. So we really got and worked with the best folks to put this together. The playbook is very easy to read, digestible, and I think importantly, chunked out also. So if you're going after that senior leadership, they don't have to read the whole thing. They can just read the first 6, 7 pages and really get an idea of what they need to do. It's set out in the background to set the landscape there. We're talking about the national urgency of safe use, as Scott has talked about, approaches that we can do with this, what stewardship is, and then a little bit of instructions on how to use the playbook. And that's just a bit of what I'm going to talk about. Then we break it out into the core elements. Excuse me, and in each of the core elements, the 7 core elements, then we'll have an overview of what that element is, implementation strategies, and I think very importantly, broken out into, if you don't have any of that at all, how do you establish it? And if you've already done some work in that core element, in one of those pillars of this, then how you can strengthen that and keep it going. And then potential barriers with very practical suggestions and solutions. And then always at each section of the core elements, tools and resources. Now, in those resources also are a lot of references. And again, about 7 years ago, when the AC Forum board decided this is what we wanted to go after, and we were going to, again, try to move the whole conversation, there was not very much literature. It is now really exploded in this issue. Allison already talked about, up to a third of DOAC prescriptions are incorrect, either the prescriptions or how they're being used. And so we think that we are now at the point that it's easy to get your senior leadership excited about this because there are so many mistakes that need fixing. Then an overview on what drivers of change, actually techniques that you can use to help effectuate this change, and then some looking forward, and then appendices that will list this. And I would suggest that even if you glance at the appendices, but the NQF did something really, really nice. This wasn't just, let's go ask the AC Forum folks what to do. They went out and found their own experts in the field and brought other folks outside of sort of the AC Forum leadership circle to give input into this. So you really have a broad expertise that's been involved in not just clinicians and pharmacists, et cetera, but FDA, the Joint Commission, et cetera. So you're getting lots of lenses that have helped color this playbook. Next slide, please. So there's some background that's laid out. A lot of that you've heard from Scott and Allison already. It's put together quite nicely. Fairly quick read, but if you're really a novice and you really want to go do this, download the playbook and just read the background for 3, 4, 5 pages, just to get an idea of sort of where we see AC Forum going with this, and where really the foundations and what stewardship means. Next slide, please. And then I've used as an example in these slides, just securing administrative leadership. I agree completely with Allison. She said this is probably the most important of the 7 core elements. And then you can see just some highlights on what establishing would be. And next slide. And then if you were lucky enough to already have senior leadership buy-in, then how can you strengthen that and move that to the next step? And how can you make sure that that doesn't fade away? So strengthening and sustaining. And then here is the barriers set up very nicely, potential barriers on the left, and then suggested and very pragmatic solutions on the right. Next slide, please. And then here are tools and resources. And I think it's pretty important because it's not only sort of references, but really a lot of these are pointing to online tools. Now, of course, a lot of those, or certainly at least some of those, point back to our own tools and resources that we have, as we know, an extensive collection here through AC Forum. And then, of course, what it is, if we can go back a slide, please. Great. And then the playbook, you actually have a QR code there if you want to scan that while it's up here for a section. And of course, these slides are always available, so it'll be easy to get that. And you can always download both of these. And you can also download the core elements for stewardship, and the playbook, of course, are fully free, as always, is what we do with AC Forum. Next slide now, please. And then policies and payments, education and accreditation, talking about some of the certification. Of course, the Joint Commission has their national patient safety goals, measurements, but really also some drivers of change on how to make that happen. So if you were now looking at the doing phase and you already were past, you understand this, lots of practical stuff. And then again with NQF, they've been doing this for a lot of years. They are, again, one of the best in the country on how to make this happen. So these drivers and change, we're excited with AC Forum because that's really stuff that's sort of outside of a lot of us at AC Forum that were involved in this project. We really went and found experts that really can help guide you how to do that. Next slide, please. And then looking forward, of course, the ultimate, as Allison has already mentioned, but I'm going to mention again, really getting this to be standards like from the Joint Commission or measures like through CMS, I think would be the ultimate goal, because we now know that antibiotic stewardship in the hospital is just common. Of course we do that. It's no one even thinks about it anymore. We think the setting and the timing is right for us to get eventually to folks saying the same thing about anticoagulation stewardship. And next slide, please. And I think a download, as I mentioned, and I think that's my last slide. Can we go? Yep, for questions. And I'm going to turn this back over to Arthur to continue to moderate for us.
All right, thank you, Scott. Excellent presentation by all. Always just so helpful. And this whole initiative is just so important. And we're finally kind of doing something, I think, to get at the baseline problem. So if we can bring all of the other speakers back on camera. You know, I want to go way back to something that Scott Winiecki pointed out that has really been on my mind for a long time, and that is just this assumption that, you know, bleeds happen with anticoagulants. They just happen, and there's nothing we can do about it. We just accept that. And the truth is, there is something we can do about that, and by giving high-level anticoagulation care, we can actually reduce those numbers. And I think this has become such just an understood. I've recently been evaluating some like cohort trial data where they're trying to define bleeding rates using just big data and pulling ICD codes. And when you actually stop and take a step back, you go, these studies are reporting 12–14% incidence of bleeding rates, which can't possibly be accurate. But the very fact that folks aren't stopping and going and acknowledging that, and are just like accepting, oh, well, there must be a thing. Yeah, you know, 12–14% of people bleed. That's not okay. And I think that, you know, an initiative in pushing anticoagulation stewardship like this, we should really start focusing on what are benchmarks for bleeding in patients who are managed very well, and how does that look different from those who are not? So I don't know, Scott Winiecki, if you had any thoughts on kind of that whole perception of bleeding is just a thing we have to deal with.
Yeah, I think all medications have adverse events, and some of them are not preventable, right? The obvious classic example would be someone who has anaphylaxis to an antibiotic, right? They have no history of anaphylaxis, they're appropriately prescribed an antibiotic, and it happens. And I think that there will be bleeding events like that with anticoagulants, right? I don't think that number is ever going to be zero. But just looking at the literature out there and seeing the amount of dosing errors, the difficulty that clinicians have identifying the right patient and getting them on the right dose means that there's a considerable amount of preventable harm out there. And, you know, in medicine, we all accept that some harm's not preventable, but we have to be careful, as you point out, Arthur, not to take the preventable harm category and just throw it in that bin that said, oh, well, these things happen. So, you know, I don't know what the right number is, right, where we've eliminated all preventable harm, but certainly I think we're not at that point. And this playbook is an effort to get there, right, to use these meds in the best, most appropriate way possible for the right patients. So we're maximizing the benefit and minimizing that part of the preventable harm. So I think that point is an important one. It's easy to dismiss this, but there are a number of errors or problems going on here. And to the extent that we can reduce that harm, then we've done right by our patients.
Mhm.
Absolutely. Scott Cage, you have thoughts?
Yeah, so, and I agree, and, you know, so Scott works on, you know, safe drug initiatives and stuff like that. And Chelsea, I know NQF is a lot of times it talks about the safe use. I think we also can't forget the effective use. We clearly know that there are a lot of AFib-related strokes with people using homeopathic doses because they're scared of DOACs that are giving us strokes that did not need to happen. So when we talk about stewardship, it's really correct dose for correct patient is what we're trying, and correct drug for that matter, that we're using. And although it's easy to point to the bleeding, I think there's a big bucket of harm that is happening to the patients when we don't use the appropriate effective dose.
Yeah, if I could just piggyback on that. I mean, I think if you're looking for low-hanging fruit, right, as ubiquitously as the direct oral anticoagulants are used, and as egregiously as they're misprescribed, off-label dosing, et cetera, you know, I think it provides a very viable target. And, you know, there are, Scott Kaatz mentioned this when he was speaking about how this body of evidence is growing, and we now have more ammunition to bring forth to our hospital administrators. There's so many good examples out there of, they're mostly pharmacist-led stewardship initiatives, but putting DOACs into the hands of the experts, right? The drug experts with familiarity of these drugs. I honestly think from the outset, we really got the messaging wrong with DOACs. You know, I often say DOACs, it's not anticoagulation for dummies, and it's not, right? I mean, we have so many unintended consequences with these drugs. We're seeing our patients less frequently, and lots can change in between those visits. The dosing can be confusing because it varies across indications, and it's got to be adjusted for a number of things. This is not easy stuff. And while, you know, my new kind of soapbox thing is that while the DOACs don't need routine monitoring, they darn sure need specialized anticoagulation management by an expert to keep, you know, these are very valuable tools, but we have to use them appropriately if we want them to perform the same as they did in the clinical trials and provide those advantages over older therapies. Stewardship all the way around.
All the way around. And to your point, I think that the mentality that we kind of have to change here is that, you know, anticoagulation services have kind of historically been, this patient needs an anticoagulant, now you go management. Well, stewardship really looks at the broader picture of who needs an anticoagulant and making sure that they're followed. So even going the next step, you know, you think about inpatient like Allison, you know, does a patient need DVT prophylaxis on the inpatient side? That's one option. But what about the next step of, you have a whole bunch of anticoagulated AFib patients, but you have a whole bunch who aren't. What can we do about those patients? And thinking really all the way around the problem of ensuring that patients are receiving the appropriate therapy. And to your point, Allison, about a tool, you've heard me say it before, and I'm sure I'll say it again, anticoagulation services are a specialty service that manage conditions in patients, not that manage drugs. So a strong anticoagulation service looks at the anticoagulants as tools in the tool bag to manage the patient. That's how I think that this is moving and should be going. So thank you for all of that. We do have some questions I wanted to get to, and a lot of them are around kind of like, how do we do this and how do we get support to do it? And I think the underlying theme, perhaps unspoken, is how do we pay for it? So there's a question, how do we get support from hospital administration to do this. And in line with that, there's some questions about where do we see regulations going? Can we get ahead of that and show value in this before they just have to react to regulations around it? You know what I mean? Any thoughts on that? I'll start with Allison, I think, on this.
Yeah, sure. I mean, those are, really important and common questions. In regards to how do you get started or where do you start, et cetera, I think, the bare naked truth is often you're not going to have a lot of resources and you're not going to have a full-blown business proposal. You're going to start by scraping together some small volunteer initiative with dedicated people who, are champions for change. And you might have to do that for a couple of months until you can get some traction and get some numbers and show some data that you can take forward to your leadership. But, three common areas that I can think of that we constantly talk about and approaches to do this is, one, figure out what your leadership is motivated by. What are their feet being held to the fire for your institution? What's the universal operating plan? What are your key performance indicators? A big lever that we lean on a lot because it's probably the strongest, national level set of requirements we have is the national patient safety goal around anticoagulants. If your hospital isn't in compliance, they're not going to get accredited. So this might be a really good talking point to approach your leadership with. Other things that I've found and others have found highly successful is identifying areas in your hospital with high cost drugs that are being inappropriately used. And I'll also say disease state management, Arthur, not just drugs, but also specialty testing, right? So thrombophilia testing, HIT testing, all things that can lead to inappropriate management and exposure of patients. And the other big area I would say is everybody's got harm events happening in relation to anticoagulants in their institution. Find the people that track those things, talk to them, highlight those cases for your leadership in venues like morbidity and mortality committees. Make this really palpable and show your administration that these events are happening right under your own roof within your four walls. That's usually a really big motivator for them to get engaged in this conversation. And then just really quickly, the second part of the question, where do we see regulations going? I see us continuing this great momentum that we've built. I see it pushing us forward. What exactly it looks like in granular detail, I don't know. I don't know if we'll end up with specific metrics like appropriate DOAC prescribing, et cetera, or if it's going to more emulate the condition of participation that exists for antibiotic stewardship in that you need, and the Joint Commission standards around antibiotics, because it exists for both of those entities. You need to be able to demonstrate that you have a program that's paying attention to it, but they don't dictate exactly what you need to look at in your institution. And that may, remain largely dependent on the individual site, at least in the initial stages. So I don't know, I'd be interested to hear Scott Kaatz or Scott Winiecki's thoughts.
Yeah, well, Allison, I'll bounce this to Chelsea for a second. Chelsea, because I know NQF also puts out some statements, and although they don't they aren't an accreditation standard or they're not a condition of participation, they really many times have helped frame those for the Joint Commission, CMS, and other payers. So any comments?
I think as NQF's role as a consensus-based entity, we're really that neutral party that brings everybody together so we can get those different voices at the table. And then certainly we have our work on the endorsement side, where if there are measures, bringing all of that evidence forward for them to be evaluated. And typically, endorsement is the gold standard of like the good housekeeping seal of approval type of thing for measures. And that's where we, most organizations, especially with limited resources, really want to put their efforts and resources behind. And so certainly there's opportunities to kind of leverage that. And then through our measure applications partnership work, MAP, that is where recommendations go for those measures that do not have to be NQF endorsed, but still a good standard for having good measures to go into federal programs as well. So we don't make those things. And again, because we bring all the stakeholders together and we are that neutral voice, I think that is why we're able to be as successful as we are and where people will continue to come back. And then with our work here, showing people how to implement them as well.
Yeah.
That helps.
Thanks.
Yeah,
Yeah,
I
so we
think
have,
you're-
I'm sorry, go ahead, Allison. Yeah.
no, I was just going to say, I think Scott Kaatz is right. I mean, NQF, I think for a long time has served as a bit of a bellwether for things like this. And so, that's one of the reasons we're extremely excited to have had this opportunity to partner with you on this to raise visibility around this issue.
We have limited time. Maybe one more quick thing I'd like to address before we hand it back over to Liz. There was one question about becoming an anticoagulation Centers of Excellence. How much does it cost? I thought I would address that very briefly. Becoming a Centers of Excellence is free. If you go on the ACE, on the anticoagulation website, specifically the Centers of Excellence website, there's an assessment there. You can print it off, use it as a checklist. You can fill out the assessment. And if you meet the qualifications, you can be named a Centers of Excellence, receive that recognition. Of course, that website also serves as a great resource center. So I thought I would answer that one very briefly. Beyond that, I wish we had more time. There's a lot of questions, a lot of good discussion around this, but I need to hand it back over to Liz to close us out.
Thank you so much, Arthur. Thank you for moderating. Allison and Scott, thank you so much for your incredible vision and leadership, developing this whole concept of anticoagulation stewardship and moving the needle. You didn't develop it, but moving it forward from Anticoagulation Forum standpoint. Sorry. Chelsea, thank you so much. It's been such a pleasure to work with National Quality Forum. And Scott Winiecki, we couldn't do this without FDA's support. So thank you for both funding and your support along the way. And we do have our next contract that we're excited to start soon. As Arthur mentioned, this webinar is accredited for credit for pharmacists, physicians, and nurses. So please click on this link to get your credit. Wanted to just remind everyone that boot camp starts this Friday and Saturday live, but it's also enduring through November 7th. So feel free to register now and join anytime during those 30 days. And lastly, our national conference registration is open. So please join us in person April 1 through 3, 2023 in San Francisco, where we will be highlighting anticoagulation stewardship throughout. And again, thank you to all of our sponsors who support this webinar program. Thank you, everyone. Have a great day.